Professional athletes are prone to quadriceps injuries, which are caused by a direct impact to the quads or a strength imbalance between the quadriceps and the hamstring group. The pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today we visit with Dr. Rhonda Bosharon, sports medicine orthopedic surgeon and athletic trainer, to tell us more about quadriceps injuries.
A quadriceps injury typically occurs at the insertion point of the quadriceps tendon into the kneecap. Injuries can also occur in the mid-substance of the muscle belly or where it connects up at the hip. Usually a quadriceps injury occurs where it inserts into the kneecap from extensive loading, traumatic injury from blunt trauma, and/or overuse injuries usually associated with high loading activities such as jumping. Symptoms can be pain at where it inserts into the kneecap with irritation with bending, jumping, and loading activities of the quadriceps. Also, there could be inflammation and tenderness in the muscle belly if the injury is at that point or where it inserts into the hip. Treatment usually involves modalities to help the pain, inflammation, and injury to the tendon or the muscle group. Additionally, physical therapy is necessary to correct any biomechanical factors predisposing the athlete to this type of injury.
Quad injury usually means a strain to the muscle, which is tearing of muscle fibers. You can actually, again, tear a very little number of fibers as a type 1 strain as opposed to type 3, which is tearing a large number of fibers. Scarring does occur in the muscle, so it's very important to stretch, to elongate that scar, to get it flexible again, enough to gain range of motion back at the knee. And then, of course, you have atrophy of the muscle because you've damaged some of the muscle fibers. So you need to strengthen those muscle fibers of the quadriceps. But you also need to balance out the quad and hamstrings. We need to pay attention to the hip, and we need to pay attention to the trunk. It could take as little as 2 weeks if it's a minor strain, or as long as 2 months if it's a major strain where we really have to strengthen back the muscle and gain full range.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.